Hello, everyone. Please, if you can hear my voice properly, can you give me any notice? Okay, great. Well, good morning, good afternoon, good evening, based on your time zone. It's our pleasure to have all of you today, and we're grateful for sparing some time to attend this starting kick-off session about the education and lifelong learning. My name is Amjed Ahmed. I'm a co-leader with my peer, Dr. Shohreh Ghasemi. I'm working on the area of innovation and entrepreneurship for the last 6 years, with a cumulative experience of almost 2 decades between industry, different domains, oil and gas, telecom, IT, and academia as well. Well, I joined several higher education institutions in Sudan, Malaysia, and Sultanate of Oman. So it's our pleasure today to have all of you, and we are looking forward to a very productive and fruitful session where we can exchange insights and ideas. I would like to give the chance to my peer, Dr. Shohreh Ghasemi, to introduce herself. Dr. Shohreh.
Hello, everyone. Hello.
Hello, Dr. Shohreh. Well, okay, we'll carry on until Dr. Shohreh joins us again. You know, technology is always not predictable. Again, thank you everyone for having the time and spending some time to join this kickoff session. Today, inshallah, we are going to talk about several agenda items, as you see in the screen. I'm going to give a brief introduction, a quick one about Global Innovation Institute, what type of certification, and its two main tracks, certification and accreditation, of course. What are the certification program it have, and what is the accreditation program portfolio they have as well? Very quick one. And then we are going to talk about the Global Innovation Summit, which is the global stage of Genie. And we'll brief about the different communities available with focusing and emphasizing about the education and lifelong learning. Then I will pass the floor to my peer, Dr. Shohreh, where she will deep dive into the education and lifelong learning community, speaking about the objectives, what is the roadmap, what we are going to do. And finally, we'll have a network and open discussions with all of you as educators to exchange insights, challenges, good showcases that you would like to share, suggestions in order to grow up with this community. So let's kick off with the first agenda items. I believe some of you already, if not majority, you heard about GENI, or Global Innovation Institute, which is the world leading professional certification, business accreditation, and membership organization in the field of applied business innovation. GENI works to develop individual careers and transform organizational achievements by advancing the professions of innovation and innovation leadership. To do this, it provides globally recognized standards, tools, publications, research, resources, professional development courses, professional certification, business accreditation, as well as networking opportunities. This is an example that summarizes in one place the Global Innovation Institute Professional Certification Portfolio. As you know, there is around 7 different certification programs that are awarded by GENI. It varies, the certification between different individuals based on the passing of the professional examination. For example, we have the Certified Innovation Professional, then Certified Design Thinking Professional, Certified Innovation Strategist, Chief Innovation Officer or Certified Chief Innovation Officer, Authorized Innovation Assessor, which is very important certificate in order to carry out the accreditation process provided by GENI, and Certified Innovation Associate, and finally, Authorized Growth Venture Assessor. So it varies from one person to another, what level of innovation we're playing, or what role of innovation we are playing in our organizations. For example, for innovation professionals, they can go for a certified innovation professional. For strategists, definitely they go to strategist, and so on. So this is the Jenny Professional Certification Portfolio. Similar to the certification program, as I start my slides, also Jenny provide a business accreditation program, okay? And each one is conducted based on a very specific type of assessment. For instance, we have certified innovative organization, certified government innovative organization, certified innovative university, and this is one of the accreditation program today we are going to focus with, because as you can see, this is related and very close to our community. And then we have accredited innovation lab, accredited business incubator, accredited accelerator program, accredited innovation training program, accredited innovation education program, innovation endorsement, and finally, certified innovative growth venture. So those are the different types of accreditation program that Jenny provide. Because as you say, there is a very big portfolio of accreditation program. We are going to take only 3 examples very quickly. And mainly we are going to focus with the certified innovative university. And also there is a certified innovative organization and government innovative organization, which could be very suitable for some type of educational institution at school levels. So let us go to the certified innovative university. Why we need accreditation body actually, or why we need the certified innovation university? I can see there are some question pop up during my speech. We are going to present, and later we are going to answer all the questions. Okay. So still, if you have some question, no problem, you can drop it in the chat area. So why we need a certified innovation university? Because this is a proof that the university demonstrates a certain level of innovation maturity, okay? And this is reversed or reserved actually for universities who have a very clear demonstration about their commitments to empower and enable the innovation and entrepreneurship into their ecosystem. And when we say ecosystem, we will see later there are 9 different categories, all of which covering the university. So we're going to assess those 9 categories. Anyhow, there are, can we go back? There are 5 different type of rating when we go to the certified innovative university: 3 stars, 4 stars. Next. Yeah, this is the framework. It's called a Certified Innovation University Innovation Enablement Capabilities Framework. To assess a university, Jenny focused with 9 different categories. As you can see, all of them related to the T&L, teaching and learning process, the operation of the university, the research, curriculum, pedagogy, facilities, faculty, intellectual property and technology transfer, professional certification, and the new venture incubation. Those are the main 9 categories. Each one have a sub-criteria, if you can see, with a total number of 24 different criteria. For example, when it came to pedagogy, we have 2 sub-criteria: the pedagogical practice presence and the pedagogy practice success and effectiveness. Similar, when it came to IP, or intellectual property and technology transfer, we have sub-criteria, for example, IP and technology transfer presence, IP, technology and transfer application and success. So this is quick overview of how we can assess the university in order to be a certified innovative university based on Jenny standard. The question is, why we need this? Of course, as you know, that every single country now, or every nation, have a national innovation agenda. So we need to assess the organizations that they are demonstrating 2 things: the capabilities in innovation, and they have results over the time. Because sometimes maybe we have the innovation capabilities, but there is no progression. So Those are the two main things why we need a framework to assess the innovation. And this is, we need the standard to assess the organization objectively, of course. Again, it's one another, and again, it's the standard. So what is the significance of this? Simply, it is important to have such a standard, okay, that is reliable, objective, evidence-based, more importantly, independently verified and globally accepted, okay? And for each one of these 9 categories we mentioned, we need to provide a reliable, objective, and evidence-based, independently verified, globally accepted materials. So it's very critical standard to measure that things or the matters related to the innovation and accurately reflect on the innovativeness of the organizations. Similar to Certified Innovation University, as I mentioned, we have a certified government innovative organization and certified innovative organization and so many others. So it's not only about the framework, but we need to see the capabilities and the outcomes of these capabilities. Next. Well, this is a brief about Jenny. This is a very nice question. I cannot control myself until we finish. Of course, once you have all the capabilities, you have the evidences that, yeah, for example, now we speak about the 9 categories. One of them is the intellectual property and technology transfer within the university. If you go to the breakdown of the Global Innovation Index, this is one of the, it's two parts, the input and the output. One of the parts of the outputs, how many IPs we secure. So, of course, this is aligned with the Global Innovation Index, and it will help organization to contribute to the country level of the Global Innovation Index. Anyhow, we'll come again to the questions at the end of the presentation. So this is a brief about Jenny, or Global Innovation Institute. Under Global Innovation Institute, there is a Global Innovation Summit. As I said, it's a global stage advancing the innovation for inclusive, sustainable, and systematic progress. Under this summit, there are several communities. In total, there are 7. And today, we are going to talk about the education and lifelong learning community. There are some other communities, as you see in the slides, but today we are going to focus with the education and lifelong learning. So what are the core objectives in general for GENIS, or Global Innovation Summit? There are 4 main core objectives. The first one, facilitate ongoing peer-to-peer learning and capacity building. Strengthen the local and regional innovation ecosystems through distributed leadership and engagement. Encourage collaborative ideation, innovation challenges, and community-driven projects. And here, my peer, Dr. Shohreh, will elaborate more about what is the roadmap for the education and lifelong learning, what we're planning to do. And finally, the last core objective is amplifying the visibility and the impact of innovation practitioners from around the world through white papers and other leadership artifacts. This is a brief introduction about Jenny and GENIS, and now I will give the floor to my peer, Dr. Shohreh, to talk more about education and lifelong learning community. Yes, Dr. Shohreh. Dr. Shohreh?
Stop.
Dr. Shohreh, can you hear me?
Since we're facing some technical problems with Dr. Shohreh, how about we take Muhammad? How about we questions and discuss them?
Hello.
You want to come up?
Well, until Dr. Shohreh join us, let me see some of the questions which have been posted in the chat area. Mr. Muhammad Al-Faris is asking about is there is any global initiative under the way to establish an internationally recognized seal or accreditation system that identify the countries, the institution, or individual as a certified innovation. Yeah, of course. As I start my presentation, yani, Jenny is the world leading organization now for the business accreditation and for the certification program. And of course, when you speak about the Global Innovation Index, for example, now we speak very briefly about the framework for assessing universities. If you can see, there are some parts for the intellectual property and technology transfer. And this is exactly what or actually, this is one of the criteria that the Global Innovation Index is looking for. As you know, the GII have two parts, the inputs, 5 parts, and the output has 5 parts as well. One of them, the number of the IPs, the number of startups, and so on. So obviously, the Genie is contributing to this. For suggestions and the challenges that you face as educator and insights and future initiatives, we will leave this until the end of the presentation. But so far, if there is any other questions, maybe you can drop it or you can ask. Well, if there is no question, let's wait for Dr. Shahiri to join. And then we'll carry forward with our presentation. Well, to save the time, I will carry forward because Dr. Shahir is still facing some technical problem. We speak about the Genie, we speak about the Genes and what are the core objectives of all the Genes communities. Now we are going to dive deep into the education and lifelong learning community in particular. So why we need this? What is the necessity of having education and lifelong learning? As all of you know, because I believe a majority are educators, now the wave of the digital transformation, it's going exponentially. That's why we need to make the education in general innovation-centric. But at the same time, as educator, we'd like to overcome the dark side of the technology usage in the education and the lifelong learning. And you know that now the application of AI generative contents, it's causing a new phenomena in the education, which is called cognitive offloading. And you know that the learning process mainly consists of 3 things, or 3 domains actually: the cognitive domain, the psychomotor, and the affective. So now, I will not mention the name of the countries, but some of the countries, the parents, they start suing HAIs or higher education institution because they realize the unethical use of these technology-based application and AI cause a phenomenon called cognitive offloading. So this is why we have this group, mainly to use the innovation or make the education innovation-centric, but at the same time, we are educator. We need to regulate and ensure the proper use of these technologies. So what is the specific objectives of education and lifelong learning? Simply sharing the insights from pilot programs, learning platforms, and an institutional reform, provide a space for members to raise the challenges and exchange practical approaches. And this is exactly what we are going to do after we finish the presentation. Produce quarterly finding and peer recommendation for education innovation. What are the themes of this community? As you see from the name, it's education and lifelong learning. So we're trying to cover all the pillars or aspects of the education and lifelong learning. Mainly, we come out with four main themes. The first one is the educational technologies or edutech and the innovative teaching methods. The second theme, the innovation in scientific research and pedagogical practices. The third one is the innovation in policy making, quality assurance, and accreditation of the education. As you know, this is a really paining area in education. Either we are talking about schools or higher education institution, because periodically we have to go through the accreditation process. So we need to find a very innovative way. Yeah, Dr. Shohreh, welcome back.
Yeah, sorry, I was, the net is so awful.
No problem.
Sorry.
No problem. Carry on. Huh?
Yes. Okay. First of all, I'm just like, hello everyone. I'm really so sorry about this delay. I'm Dr. Shohreh Ghasemi. I'm also oral maxillofacial surgeon, researcher, educator, international academic affiliations, former faculty of Augusta University, advisory board of Oklahoma University in also leadership. Also, I'm right now advisory board of American University of Medical Science in Iowa, and also I'm faculty there. I'm all around the world anyway. Actually, first of all, thank you so much for giving me time about talking about the innovations, how we can have in a research or in education. As we know that everyone, even also can be a doctor or scientist, but the career should be shaped by building bridges across a clinical practice and also educational innovations and policy making. This and also can give the even the healthcare providers or researcher to much more be passionate about how lifelong learning actually can transform the health and education system. Okay, can we go one more slide? Okay, perfect. Regarding of the roading of the how initiative and how the programs, first of all, we are hosting and also moderating the community related to the sessions or venues. It can be, again, related to the healthcare. It can be related to educators, about the researchers. And also, we can onboard the new members to come, especially the young or junior researcher can also be intrigued to join into the community and engage those new members around the different, initiatives. And the other things is that we can develop a community project together. It means that sometimes we shouldn't be at the same field. Yeah, actually, I'm just also like mentor for Association of Women Surgeons, but it doesn't mean that all of us we are surgeons. We have also a medical student. We have also pre-med. Also, we have different aspects of field of medical, but we can just collaborate together as a teamwork, and we can outreach and engage with the relative, and also the different organizations to bring much more new things and innovations. And as you know that right now, especially about AI, AI is right now, it's just like the big looming. And as you know that, especially in the radiology, right now, I think there's in next few years, we are not going to have a major based on radiology. Like for instance, in dental, we have right now the corneal crash that they have AI use it, the OPG or periapical of the patient, give you the treatment plan, and the accuracy is 94-95%. It means that all of us, we should be all together as a teamwork to just make the community much better and much more profitable. Okay, can I just move forward? Again, also about the educational technology, as I told you, and also the initiative to have it like teaching methods. In my work, as I told you, I have developed and taught simulation-based learning and also digital health curricula and international C and CME. And I think that right now with these innovations in scientific research and pedagogy practices, we can have much more research to integrate it in a multidisciplinary approaches, from regenerative medicine to educational to the head and neck oncology, and much more. Right now, we are moving forward to personalized medicine. And also regarding of the role of the educator and institution, I believe that institution must be driven of innovations and educator, the tools and networking to implement the changes. And the roadmap for that is just like helping on board and mentor the new boards, leading and participating. The most important things, even also United States and all around the world, is based on networking. And I think that is a best, community that everyone can engage with different, field of majors, that we can support the outreach to authorities and institutions, leading and also participating in community-driven projects, and especially like contributing some white papers that can amplify the innovations in a lifeline beings. And I would be glad if you want in future for any contribution to research and policy perspective to these aspects. And I think that first of all, don't forget to just join as a member. And second is that definitely just like spread all over to your colleagues and, even also the junior researcher. And I think that if anyone just pop in and with the new project, they can just share to us and we will be glad to join. And we can have a great, project and proposal in the near future. If you have any lessons, just like any kind of like hints or any questions, just let me know, or Dr. Amjed. And thank you, Dr. Amjed and Jida, Dr. Jida, that you just already helped. And sorry about those distractions that happened. If you have any questions, just let me know.
Well, thank you very much, Dr. Shohreh. And it's looked that the weather is very nice at your end.
Oh, thank you. Thank you.
Yeah. Okay. I think now we reach to the end of the brief, and this is the time where we would like to hear from the attendees as educator. If you have any challenges that you face during your journey, if there is any gap that you identified, and we should do any initiatives on that gap identification. If there is any good showcases you would like to share with us, suggestions, insight, I think this is the time. I will give this the floor for the attendees or the participants. Before you start speaking, please introduce yourself. What is your affiliates, and go ahead.
Anyone doesn't have any questions? Like myself, Dr. Amjad, about myself, my background is like medical, but I think right now myself that I need to just be much more accurate and precise is to be much more in AI, and different aspects like GitHub's Pythons that can help me in a healthcare and also in a diagnostic test. This is maybe much more my challenge, as a healthcare provider.
Thank you, Dr. Shohreh. And also, I don't know if you would like to give them some insights about your experience of using the AI or the augmented reality and virtual reality as a diagnostic.
Yeah, exactly. Right now, also, if anyone interested about the NASA Open Doc, I think that me and we just already mentioned some of the don't use this code, that you can just get into. It's free of charge. Everyone can just get information about the different aspects about AI, even how to do the research, how to write a proposal, how to even submit a proposal for NASA. Myself also right now, I'm working as a public committee member for AAI, for American Astronaut, and also is related to NASA. But right now, as I told you, everything has been changed. Much more robotic surgery just comes in. For instance, Da Vinci is like the well-known and innovative actually robotic that comes for the not just in a head and neck surgery, because it gives you much more precise, even less downtime for the patients. But also we have it in oncology, we have in gynecology, and this is one of the toughest actually. But also regarding in a dental, as I told you about the radiology, right now we have different apps based on AI that give you 94% accuracy. It means that it means that why you should just like instead of like going for oral maxillofacial radiology for 4 years or even 3 years or 2 years even, But right now we have an app, you have subscribed, and monthly you pay 400, and like you can have millions of like OPG and also different pornographic, and it will give you the same treatment plan. The accuracy is 94%. That's why I think that in also in a like as a healthcare provider, even in a medicine, we need to have much more like kind of, first of all, if we want to just be glooming and be glitter, even as a provider, we need to be one step like forward, one step ahead. And we should be the frontier. And right now, AI, biomedical, I think that also computer engineering, these are should be all together integrated with the healthcare provider to be a frontier, in their major.
Yeah, of course, of course. 100% I agree with you. This is the new era of interdisciplinary, research and innovation related work. And
Yeah,
now the AI have became خلاص, it's a fact. We're using the AI in everyday medical diagnosing by using the image processing for the X-rays and so on. So I think this is a very good area that we can explore together.
exactly. Yeah. For instance, also 3 years ago, with one of my researchers that he's a fellow of me, we did a patent with USPTO about AI in dentistry that
Wonderful.
gives you the exact color of the teeth that you're, I don't know, A1, A2, A3, B3, but give you exact as a universal kit. And if you have a restorative dentist, can give you exactly also after that which color is matches with your skin and with your ethnicity, And it was
Wonderful.
really challenging for us, and we just learned a lot because we were thinking to start with VR, but we just moved forward with AI.
Wonderful. Wonderful. I don't know if any one of the attendees or participants would like to share insights with the projects that Dr. Shohreh just mentioned. Any interest or insight on this area of using the AI in the medical field for diagnosing for a lot of purposes? Personally, I will add to Dr. Shohreh's statement. Currently, I'm working on an initiative of how we make the accreditation and the policy making and more easy to implement. Because as I said during my presentation, this is a very penny area, particularly when it came to the periodic review of the accreditation. You know that HAIs, they go for this process every 5 years. And this is really, I believe that majority of you go through this before, maybe by delegating some tasks, maybe by being a member on accreditation committee. So it's a very paining, and you can see the whole organization in a very panic mode. Sometimes, of course, not always, but we are thinking, personally, I'm thinking about having initiatives surrounding this area of policy making to show the empathy with the employees when we develop the policies, because sometimes again, there are some policies, I believe, again, majority of you, sometimes you go through policy which you feel make the work more difficult for you. And sometimes you can find in some organizations there are two different policies belonging to two different business units, but there are some type of overlapping, or maybe, I don't like to say the word, a contradiction. So why not we using innovation, or we make the development of these policies more innovative, more human-centric, and also the same,
Exactly.
making the accreditation process more easier for all of us. Of course, we have to be compliant with the standards and everything, but the process itself, we may make it more easier and human-centric and more innovative. So this is one of the initiatives from my side and one initiative from Dr. Shohreh's side. Now we would like to hear from the participants or the attendees if they have any challenges or gaps they would like to identify, even if suggestions or insights, so we can collectively contribute to the roadmap of this community.
Hello. Hello.
Hello.
Oh, I hope you guys had a good day. I want to add a little bit of concerns and suggestions about the topic you guys just mentioned about innovation and accreditation methods, because
Laya,
yes.
would you mind if you can introduce yourself and the affiliation? Because we'd like to get connected. One of the main outcomes of or the aim of this session is to connect it. So would you like to introduce yourself and the affiliation?
Yeah, I finished my bachelor's just last week. I do consider myself uh, a passionate advocate for lifelong learning. Part of the reason I'm working in corporate right now is to become a teacher and eventually a doctor in business and economics. Um, so I do believe that experience and learning go hand in hand. Uh, so yeah, that's my goal with joining the community. Um, I was thinking while you guys were talking just now about like some outdated and to be honest, like some things that aren't as inclusive as they need to be, such as things in research like the H index, which can incentivize researchers to go for um, more like popular research topics rather than going into more like niche and needed research topics. um, and what you guys were saying about accreditation accessibility, I and someone mentioned this in the chat as well, is how can we integrate more into the global community accreditation and stuff. And I think building systems that cater to the way that different countries promote education and promote research can be very useful, and tailoring uh, some methods of innovation and accreditation to the way these countries not only educate but also learn can be very beneficial for the globalization we're seeing right now in business and education. And yeah, so yeah.
Okay, thank you. Sorry, I just distracted you. First of all, it was such a pleasure to just have your beautiful sound. Regarding of research and methodology, I'm just going to share much more. Don't use these codes. It's from the NASA Open Doc that it gives you much more details from A to Z about how to do research. I don't know, like what is systematic meta-analysis, how to do data extraction, what is the umbrella study, and you are going to get a certificate plus verifications, in your LinkedIn. And also, it's great if you want to have much more better networking with the also professor there. I'm going to share it more. And second, also regarding of right now, everything is going to be globalized. I want to say about the United States that right now, some of the international medical graduated from like some states because of lack of doctors, they are going to accept it. It means that in future, I think everyone going to be in the same level and much more globalized. But regarding of like CODA accreditation after 5 years, that's why we need to be one step forward. We need to be frontier that definitely we need to be like know about AI, know about Python, know about GitHub, different kind of the things that the university or the college should bring it and also teach to the students, because then get much more accreditation after 5 years. Because if they're still old-fashioned educational, it means that anyway they're going to not get there or renew the accreditation after 5 years. But if you want, we can also maybe till next 3 weeks or 4 weeks. I don't know if Dr. Jida and also Dr. Amjed was okay with that. If you want, we can share a I don't know, white paper, and we can work together. And also about the specialty, maybe I can help you. But I'm much more in a healthcare. But if you want, I can help you. Dr. Amjad, he's very nice, and he just keep also helping two of my friends, one in Singapore and the other one also in United Arab Emirates, for accreditation. But you are welcome to just like pop in any emails or shoot us an email and with the white papers. And definitely, if you want to do research, I'm doing also research. A lot of my fellows, you can just work with us, as a team group, and just let me know. Hello, do you have my sound?
Yes, we can hear you, Dr. Shohreh. I think
Okay.
Adil had a question at one point. I'm not sure if he's interested.
Yes, assalamu alaikum. Can you hear me?
Yes.
I'm Adil. I operate a pre-seed venture studio. I live in Maryland, United States, and one of our three focus areas is future of work, wealth, and well-being. So this is very much aligned with future of work. We are very much interested in the way the whole career landscape is changing because of AI. There's at the same time excitement and also a lot of concern how people may, how nations or public service agencies will deal with 20, 30, 40%
Exactly, yeah.
people or even more. I have heard anything anywhere between 10% to 99% unemployability. It's truth is probably somewhere in the middle. So the reason I'm very excited to be part of this conversation is that I think we need to, inshallah, spend some of our capacity figuring out when we say impact in this changed landscape, what that means, right? A very concrete example is most of the educational institutes now measure their success in terms of their graduation rate, but very few measure how many of them are gainfully employed using the
Exactly. We
skills
don't
they
know
have
about
learned in
yes,
the
the workforce development.
in the
We
university,
don't-
right?
yeah, yes.
Yeah. So
We
I'd love
paying
to
those high
engage in this
tuitions, yeah, yes. Paying those high tuitions and they don't know what is the perspective after the graduation. That's true. That's a nice title. Maybe we can write a paper together. And also the Central Michigan University, the president, Dr. Neil Mackinnon, he's also very like he has lots of like in a Lancet also he published. Maybe we can just collaborate with for any publications, you know, and make it maybe as a protocol and standard for the globally. That's nice, you know, because this is not just United States and all around the world, just also in Middle East, you know. The people are graduated even from the great universities or colleges, but they don't know, are they going to be employed in United?
Yeah, I would love to
Yeah,
work
just if it is
in any
possible, just
capacity with
yeah,
anyone
just if
who's
it's possible, anyone just shoot us or just email me, Dr. Amjed and Dr. Jida to just like any questions you have or by paper, and we can have, you know, some kind of like maybe collaboration together. We can meet one more maybe in a Zoom meeting call and see which topic is much more enthusiastic for everyone, and we can move forward. Why not? Everyone, we are as a human beings, if as a teamwork, we should do it. We should make everything different right now.
absolutely. Yeah, thank you so much. I'd stay tuned
And make the
and
protocol
we'll
much more
work together.
globalized.
Thanks.
Assalamu alaikum.
Wa alaikum salam wa rahmatullah.
Yeah, thank you for this great webinar. My name is Mohammed Shohreh, working as Director of Innovation at health in the healthcare sector in Saudi Arabia and Riyadh. It's really interesting that our guest is working in the healthcare landscape as well. Maybe this brings me back to the last summit had in Dubai. We had a very fruitful discussion in the healthcare panel, which is one of the audience was asking about AI and its intervention within the healthcare landscape, how it's going to change the game in the future. And we believe that in such a critical landscape or area of business, which is healthcare, dealing with patient and patient's life as well. AI, we believe that will not change us, will not replace us, but people mastering and using AI effectively and efficiently, they might replace us too. And this will bring us to an idea about implementing and applying AI in healthcare landscape and ecosystem worldwide. And maybe this will be linked to something which we call it the best practice. Best practice somewhere maybe is not to be the best practice in my country. Best practice in Dubai, for example, or UAE or Kuwait. It's not necessarily to be best practice in Saudi Arabia, etc. I believe that individualizing the practice of AI within the healthcare, for example, and I think all other industries, has to be through a governance and well-structured framework to be effectively implemented. And maybe this is just a view, opinion, and insight about it. Will drive me to maybe a simple question about type of accreditation of innovation. I'm doing the training for a couple of years, so I'm thinking about in the future, what if we do have some specified innovation/AI related certification in the coming years by Genie. This is something just comes to my mind recently, and maybe we can study the potential of its effectiveness and etc. And we do have some related education courses and training about healthcare and innovation. And I am just opening the channel for communication if anyone want to learn from our experiments and experience in terms of implementing courses and the training sessions within the healthcare sectors related to innovation. I am willing to provide such a guidance on even objectives courses what we have done to be conducted at their place.
Wonderful. This is really wonderful. Thank you very much, Mohammed, for the great insights. I totally agree with him because the future is about the AI. Maybe we have some specific certificate that tailored for the AI and specifically in future. Well, there is any other insights I would like to share with us?
Anyone wants to ask a question, discuss something?
Well, then I would drop a question, just to warm up the group. What is the main challenge that you face as educator with your daily based activities and that you feel it's causing a problem for you? Laya.
Yeah, hi. I wanted to mention not only AI in education and how that's affecting the lack of people learning these like very important research methods and how to actually research and use search engines and like other resources available, but as well how it's affecting like kids from a very young age who are becoming reliant on them to solve their math problems, and even I feel like maybe more concerningly, relying on AI to for creative inspiration. I'm not sure how this will affect future generations, but it can't be anything positive. There was a study that came out recently that showed that like prolific AI users forget things that they wrote as low as 11 minutes after they've written it. And so yeah, so cognitive function we're seeing is being, huh? Yeah.
Carry on.
And I'm not really sure what's if anything is being done right now to combat the speed at which AI is replacing writing and thinking skills being developed. Because as we know, a few months ago, Trump signed, like for example, an example in the U.S. is Trump signed a law that forbid any regulation on AI for the next 10 years. So we're seeing some push and pull from the international community. But I do believe that AI is the biggest obstacle that educators will have to overcome in the next 20 or so years while we learn how to deal with it and utilize it efficiently and well. Yeah.
Yeah, thank you very much, Laya. Really, you address a very important point for us as educator, and it's a very penny point. That's why if you see when we start introducing the education lifelong learning, we say what is the necessity. One of them, how we overcome the dark side of using the AI. And I totally agree with you because the cognitive domain is the most important domain of the learning process. Of course, we cannot sacrifice the psychomotor and affective, but this is very important. And now, I mentioned this during the presentation, there is a new phenomenon called cognitive offloading, because the kids, they joining the HAIs or the schools, the first year they're scoring A+. After a while, they rely on the AI because of the unethical use then they start to be transformed into lazy people and dummy. And that's why there are some parents, and they start suing the HAIs without mentioning the country. And I totally agree with you. We need to have a very proper regulation and initiatives to regulate the use of AI. Otherwise, our child's in risk, And in alignment to what you mentioned, if you're following the news, just yesterday in the General Assembly of the United Nations, they kick off an initiative of how we're regulating the usage of AI, and they already allocate a fund to have capital to be invested on this. So I think, yeah, I agree with you, because technology and AI, if it have not been regulated of how we use it, this will be against us. And this will be one of the main initiative for this community, how we can overcome the dark side of the AI and technology usage in education in general. And we are happy, of course, to have you. Any more insights or questions? Someone is raising the hand. Mohammed.
Yes, again, I'm taking the chance to just comment on what have been mentioned about the AI. Maybe I believe one of the solutions to overcome that critical and real challenge is by the adoption from the government itself. For example, in the Kingdom of Saudi Arabia, we had the initiative, which is a million Saudi using AI, which this initiative is adopted by the Sadaya, which is the authority of using AI in our kingdom. So what does that mean? It means they will train and educate at the beginning 1 million Saudi about the proper using of AI from ethical point of view, from best usage point of view, from its relations to our need in our country, even the culture barrier point of view. So it's like a blended initiatives that definitely has an aim to train people about using something that will be beneficial for our country, but also keeping in our minds and the red flag about the way and the ethical and the healthy way of use it within our daily life. So just to comment about this.
Yeah, of course. Thank you, Mohammed. And of course, there is no doubt. We cannot escape using the AI, because if we stop using the AI, of course, for me, I'm a technology-based person, by the way. I graduated in 2005 with a computer science bachelor, and then joined the industry, as I say, different domains, and again, move on with my postgraduate in technology. But the main problem is the unethical or the improper way of using the AI. This will cause the problem. But using the AI, we cannot leave it behind. Otherwise, the progression of our organizations, or even if we talk country level, of course, will be much more slower than the others. Because for me as a technology guy, I believe the AI mainly it's about one thing, the efficiency and the speed of doing the tasks. So we cannot leave such a huge power behind, but we need to use it in the proper way. So we keep the human being factor as well saved. There is a very nice question from Zahra Al-Mahdi. Zahra, would you like to introduce yourself, and you're working in which organization, so we can have this type of connectivity? Zahra. Anyhow, she's asking and wondering actually, what is after AI? And can the education, or could the education tailored more toward the emotional intelligence? And could the AI take over of this? Already, the emotional intelligence now has become a pillar, not only in education, but even in other organizations. And the main purpose of emotional intelligence is to give the empathy with the colleagues or employees, so you know how to better trigger them to give their best level. So emotional intelligence is there because, for example, for us as educator, we need to watch the body language, for example, inside the class, and we need to know the personalities of the students inside the class so we can trigger them. And this is one of the things that I believe, even though there are smart classes now, a fully smart campus and cameras that can monitor the facial expressions of the students inside the class and give the feedback to the teacher or instructor. But personally, I believe this is the part of the human factor cannot be replaced by the AI.
And I think that even also after AI, we are going to have the state of quantum, But the things is that lots of we are going to have lots of things with the data extractions, different kind of things till 2030, and then 2030 we are going to have a new maybe technology that based on the state of quantum.
I apologize for this, but seems like there's been a lot of technical issues during the session. Unfortunately, Dr. Amjed has left us. I think it's about time we wrap up this session. Hopefully, we'll be able to have a next one sometime soon where everyone can join us again. Hopefully, no technical issues next time. I've dropped the community link on the chat. You're all welcome to join. And yes, we'll see you again next time. Dr. Shohreh, is there anything you want to add?